It's the 20th day of April, and the United Nations has set aside today as World Day for Safety and Health at Work. And being that as it is, the challenge of workers contracting infectious diseases at workplace, despite also having injuries in the course of it all, there is need, basically at the point where we have a pandemic, to really look at a way of arresting and containing the virus. And discussing this with me, I have a safety expert, an electrical engineer, and treasurer, Institute of Safety Professionals of Nigeria, Edo State, Prince Charles EWEKA. Thanks for coming, Prince Charles.
Thank you very much for having me.
Well, good to know we have Prince Charles in Nigeria.
Yeah.
Okay, looking at what we have here, it's quite a global pandemic, and the challenge of fighting infectious diseases, as today is set aside by United Nations for World Day for Safety and Health. What do you see as the significance of the day?
Very good. World safety for health of workers in the place of work originated from the ILO, International Labour Organization, put up this day, 28th of April of every year, to celebrate two things. First of all, workers that died during active service and those who became injured. So 28th day was to commemorate and honor them. This started in 1996, but by 2003, the ILO decided that rather than just stopping at honoring those who have died and those who are injured, why don't we prevent such injuries and deaths in future? So now came up with the World Safety Day for Health at the place of work. We started in 2003. And so we combine the two every year to remember the dead, the injured, and then to plan on how to safeguard the workers in the place of work. So it is very significant and very important thing that has happened to the labor force to ensure that when they finish work at the place of occupation, they're able to go home health and sound.
It's quite important you are saying this because we've had situations where capitalists, where those who do business basically for profit, like employers of labor, for instance, do not care basically for these needs of their employees. Talk in that direction.
That is the whole essence of this exercise, to reawaken the consciousness of the employers that these employees are not wastable commodities. They are assets that you can develop and give you more profit. And therefore, their safety, their well-being, their health status, the more you improve on it, the more profit you make as a body. So it is unfortunate that these so-called capitalists focus more on the financial gains they are making, but forget those who enable them to make those profits. And therefore, wise companies realize that it is very pertinent to improve on the health and safety of their workers so that they can maximize profit. Workers who fall ill during the work, they don't come to work. You pay them while they are off sick. That is a loss to the company. And therefore, the need for the worker to remain on duty post for the 8 hours or so is better for the company. So if you look at multinational companies these days, they have keyed into health and safety of their workers to the extent that they want to reduce health issues, accident cases to the barest minimum over the period of 1 year. At the end of the day, when they compare what they invested in providing health and safety issues for their workers compare it to the losses they would have made if these workers were involved in accidents or health challenges.
Okay.
They discover that they make more profit.
Okay.
So those companies that have not yet keyed into it are the reasons why this World Safety Day campaign.
Okay. Being that as important as it is, there's this novel coronavirus disease that is really ravaging the globe. Now, talking this direction and the need or the role of the employers and employees to curtail the spread.
Yeah. Now, go back to 1917, 1918, when the first influenza came. A lot of things were taken for granted, which is what also happened this time around. We have to be proactive in our dealings with whatever form of ailment or threat to health. Yes, it is not to wait until it happens before we begin to take action. Right
but this
now,
one was this one took the world unawares.
I agree. It took us unawares, but it started from somewhere at a certain point in time. But over a period of a month or two, it started spreading overseas because we in the other part of the world did not take proactive measures to decide on what to do immediately so that you stem the tide of events. But right now it has happened. So what is the next step? Government has taken decisions to help us contain the spread. Since this virus is already out, we will not allow it to extend to everybody. In 1917, 1918, over 500 million people were infected in the whole world. And 20 to 50 million people died across the globe. We don't want that to happen again. So, all the strategies, all the advice that government has given, that we must obey them. It is not to help government. It is to help us, the individuals, who are faced with the day-to-day activities.
Okay.
Therefore, all and sundry, both employer and employee, must key into preventive actions that have been outlined. One, that we should wash our hands regularly with soap and running water.
That means providing this facility in the various workplaces.
Yes, they have to be provided, because if you do not provide that, the worker will go and do what is not supposed to do. Perhaps you can take a bowl of water and wash his hands to fulfill all righteousness. But if this thing is provided and you educate the people on the best way to do it, and then you make sure that people are stationed to monitor what they are doing, then you will get the best result. Secondly, that we should use face mask if there is need for us to go outside of the house. Otherwise, we should stay indoors. And if we have any kind of symptoms that is related to this, we should make immediate call to the relevant authorities. If we follow these things the way it should be followed, you will not have problem.
Okay, but again, we are also living a very big factor in the area of testing kits. Now, most especially where in organizations there is need for workers to be tested. But now we have a global situation where even test kits are really scanty. What do you advise?
Yes, well, we have to make do with what we have at the moment.
Yeah.
While government is planning ahead. But this happenings is a wake-up call for all of us across the board. Government, legislators, employers of labor, the labor force itself. Is for us to retrospect now and look at how did this affect us? What can we do to make sure that in future, if such a thing occurs, we can quickly stem it? So it is a good challenge, that's the way I look at it, that will enable various stakeholders to put things in proper perspective in future. Firstly, government must take a stand now on health issues, healthcare provision in Nigeria. Federal, state, local government. These health facilities should go to the localities. There is nothing stopping these governments from providing primary health center in each ward. In each ward, okay. not each local government.
In each ward?
In each ward. A health center of a room, 2 rooms, 3 rooms, with a medical practitioner, with a qualified nurse, a pathologist, just 3 or 4 people,
okay,
who can take emergency cases. And issues like this, if we had these things in place, all we would have done is send test kits to the doctors who are there, so that they can manage the small environment they are in. Anything that is beyond that will go to the general hospital.
Okay.
This should not be a situation where all and sundry, I have headache, I have malaria, I must go to general hospital or teaching hospital. No. So it is an eye-opener, and I pray that our governments, especially, let me restrict myself to Edo State, because this is my state. Our governor should please set up a small think tank that will look beyond this pandemic. They are already putting strategies in place on how to curtail it, and works are on how to provide vaccines. But what do we do after now? Okay. Look at our hospitals. Look at our markets. For example, these are sources where you can get infections. Look at the sanitation. Every house in Benin, or in Edo State, has a borehole. Every house has...
Is it right to say every house?
Okay.
Really?
Most.
Okay.
Most houses have boreholes. Most houses have a soakaway pit, septic tank. And if you go around, you may discover that where a borehole is sited is not far from where the soakaway pit is.
Okay.
And so
that could lead to an outbreak.
Yes. With time, I've been afraid about this. So we need to develop and reawaken our public water supply system. That is major. To stop cases of cholera and things like this in future. Almost every house is a cemetery. And we are recording deaths here and there. Most deaths are not investigated to know the cause. So if a corpse that is laden with a transmittable disease is buried in the compound near a soakaway pit, close to a borehole, there will be tendency that one day those virus or organisms may seep into the groundwater, which will be pumped up and then used, contaminating everybody.
That's a big challenge.
So a lot of things that are not in place now, we need to look at them and fashion out how to solve the problem. Okay,
thank you. In case you're just joining us, it's TMI Tuesday, and I've been having a chat with Prince Charles EWEKA. And Prince Charles EWEKA is a treasurer, Institute of Safety Professionals of Nigeria. He's also an electrical engineer. Well, Prince Charles, before I let you go on this segment, let's look at the areas of offenders, for instance, of employers of labor, where they get cheap labor, and in the course of it, they leave them unattended to health-wise, and most of them even get these problems of infectious diseases in the course of doing their job, and then they are left without even taken care of, laid off. What is your action in this direction?
This was what led to the formation of the International Labour Organization.
ILO.
Yes. Unfortunately, as at 21st century, those problems are still there, especially in our country. Major problem is no enforcement. Our court systems are slow. So a worker that has a workplace injury or ailment or fatality can go to court. How long will the court last?
If the worker even has the wherewithal to get a lawyer, finance it.
The duration of investigation and court things dampen morale.
Yes.
So you decide to leave things to fate. But in actuality, the government is supposed to penalize. You know, fast track. That is why these industrial courts, they are available now.
Okay, yes.
Even though, well, they are just picking up. But these are areas they should focus on. Workplace accidents or incidences that result to maybe injuries or fatalities or long-term health problems like back pain, like cancer resulting from what they are using to
the environment.
Yes, and things like that. So if a company or an employer of labor is sanctioned, for example, if a worker dies in your company and you investigate this, you now discover that it was negligence of the company to provide safety wears and things like that, and it is traced down that it wasn't the fault of the worker, but the fault of it. And then you charge that employer. For example, you give him a bill of 100 million to pay as compensation. If that company pays 100 million today, he will not want to pay that 100 million again tomorrow.
Yeah, that's
so
a deterrent.
Yes, it will be a deterrent.
Check.
But when things are done and people get away with it, then what do you expect? So this is why we are advocating. The Institute of Safety Professionals, we advocate, we let service providers, employers of labor know the implications of not taking proper care of their workers.
Okay.
Because by the time you toy with the law and things heat up, you may end up losing your company or even going to jail. So we need to strengthen our surveillance and enforcement and then improve on the length of time that cases take in the courts.
Thank you so much, Prince Charles EWEKA, for taking our time to be with us today,
for having us.
which serves as World Day for Safety and Health at Work. And we're going to be also having more discussion in the area of the presidential broadcast that was witnessed yesterday over the extension of some places that are presently experiencing lockdown, basically Lagos State, of course, Ogun, and the FCT. And I have a public affairs analyst, God sent Aaron said, to tackle this issue with me on that. Okay, we'll also look at issues about the resignation of the chief of staff to the governor of Edo State, Governor Obaseki, Taiwo Akerele, and the political development, what it could be heating up in that direction. Stay with me. Big thanks, Prince Charles, once again,
Thank you
for taking our time to be with us on the show.
Thank you. Have a nice day.